Good day everyone, I am Allyssa Mariel Partoza and today we are going to talk about Carbapenems. Carbapenems is another type of semi-synthetic, extremely potent, and broad-spectrum beta-lactam antibiotics. Carbapenem contains a beta-lactam ring fused with a 5-membered phanem ring. The mechanism of action is the same as other beta-lactam antibiotics, as they inhibit the cell wall synthesis and that makes them bactericidal in nature. When we talk about carbapenems, I want you to remember carbs, phanem. So first we have carbs. What comes in our minds when somebody says carbs? Rice, bread, pasta, food? Carbs have both positive and negative effects. Less intake of carbs can be positive for the body and too much carbs can be negative. Carbapenems and carbs are kind of similar. How? Carbapenems and carbs can be both positive and negative in the sense that carbapenems are used in treating gram-positive and gram-negative bacteria. Carbapenems have a broad spectrum of uses, which also means that there is a long list as to what it will treat. We can also compare the two by the route where it passes or its administration. So unlike carbs, carbapenems are not consumable and can only be given by intramuscular or intravenous injection. Moving on to P, which stands for polyribosomal part of the cell that changes protein function in order to prevent cell division or the site of action. The last one, phanem, which is the suffix used with all drugs under carbapenems. So, under carbs, we have discussed about its usage and the route of administration, P for the site of action, and phanem for the suffix of drugs under carbapenem. There are 5 classifications of carbapenems: imipenem, meropenem, ertapenem, doripenem, and pharopenem. Today, let's discuss about imipenem. So, imipenem is one of the most important beta-lactam antibiotic under Carbapenem. So, every time we hear the drug imipenem, we must associate it with cystatin. So, why? Because whenever we administrate imipenem, we give it with cystatin, which is a dihydropeptidase inhibitor. One of the reasons why imipenem must be combined with cystatin, because cystatin is a dihydropeptidase inhibitor as said earlier, and imipenem is hydrolyzed by dihydropeptidase in the kidney. Cystatin, if combined with imipenem, can prevent hydrolyzation of imipenem in the kidney, and after metabolism, imipenem is converted into nephrotoxic metabolite, thus the production is prevented, which can increase the concentration of non-metabolized drug in the urinary tract. So, it is combined with cystatin, which again is a dihydropeptidase inhibitor, which can also result to increase of its half-life. Other semi-synthetic carbapenems like meropenem and bayapenem resist hydrolysis by dihydropeptidase, so they are injected without cystatin. So, antibacterial activity of carbapenems. Carbapenems are active against almost all important aerobes and anaerobes. So, meropenem and bayapenem are slightly less active than imipenem against gram-positive bacteria but better against gram-negative bacteria. Side effects includes gastrointestinal disturbances like diarrhea, hypersalivation in dogs after repeated IV infusion, hypersensitivity reactions, and seizures, which are rarely reported in humans. So, talking about seizures, when administering carbapenems, make sure to not give it to a patient that has a history of seizure disorders because it increases the volume or impact of seizures. Clinical application in humans includes hospital-acquired infection, intra-abdominal infection, and severe lower respiratory tract infection. Its use in veterinary medicine is limited. This ends our discussion for carbapenems, and I hope you've learned something. Thank you.